Hello, I'm Dr. Linda Thompson. I'm a licensed marriage and family therapist and a licensed professional counselor. I also serve as the executive director of Drug Free Manatee and the statewide coordinator of the Handle with Care Florida program. We are happy to offer you this training today in trauma-informed care for early learners and also to introduce you to the Handle with Care model. By the end of this presentation, you should be able to understand the effects of trauma on child development. You should be able to identify ACEs or adverse childhood experiences and toxic stressors that can impact a child's development. You will also understand the Handle with Care program and the process for receiving Handle with Care notices at your daycare or early learning center, and how to respond in a trauma-informed way. And finally, you will be able to demonstrate an understanding of this presentation and receive a certificate after completing a very short quiz and following the prompts. These certificates can serve as professional development and also be maintained in your workplace's human resources file. We're going to talk specifically at length today about adverse childhood experiences, or ACEs. You may have heard the term ACEs in other trainings or in current literature. There's a lot of research being done on the impact of trauma on children, and that's what brings us together today. We're going to start off by a brief video that will explain a little bit more about the impact of adverse childhood experiences on the brain, the body, and behavior.
A child's experiences early in life are important building blocks for the developing brain. Genes, nature, are like the blueprint. They provide the basic framework for brain development. However, genes do not design the brain completely. Environmental influences, nurture, fine-tune how the brain works by shaping which brain connections get used. Connections that are used more grow stronger and more permanent, whereas ones that do not get much use fade away. Together, genes and the environment build the foundation for all future development. Safe, stable, and nurturing relationships early in life lead to healthy development. But children's brains capture other experiences as well. Stressful events. However, not all stress is bad. Positive stress involves normal childhood experiences, like starting daycare or meeting a new person for the first time. This stress is essential for healthy development because it helps children develop coping skills and confidence. But when stress is frequent, chronic, and uncontrolled, it is toxic to children, especially when they do not have a caregiver to provide support or buffer the stress. Adverse childhood experiences, ACEs, such as abuse, neglect, exposure to intimate partner violence, parental depression or addiction, and poverty, are toxic stressors which could lead to lifelong changes in learning and behavior. ACEs early in development can impact social, emotional, and cognitive functioning, increased risk-taking behavior such as drinking and substance use, and increased risk of disease, disability, and social problems later in life. The question is, how do adverse childhood experiences impact a lifelong development? One of the most important systems in our body is our stress system. It's activated when we experience stress. We become alert, our heart rate increases, and so do our stress hormone levels, cortisol and adrenaline. Our body is ready to react, what is known as fight or flight. A short period of time after the stress is over, or if a child receives support from a caregiver, the stress response turns off and the body returns to a normal state. Adverse childhood experiences create stress responses that stay active, and without the support of a caregiver, the system has difficulty shutting off completely. This constant and prolonged activation can affect immune system functioning and increase the chances of sickness, infection, and disease. Prolonged activation of stress hormones is also toxic to the brain. Certain areas of the brain are more vulnerable to toxic stress, including the executive center or the brain's control center, an area important for solving complex problems, attention, reasoning, impulsivity, inhibition, and learning. A second area is the emotional center, the brain's alarm system, which is involved in processing and interpreting emotions and the ability to control impulses. The third area is the memory and learning center, the brain's filing cabinet, which plays a major role in learning and the formation and retrieval of memories. Science shows that adverse childhood experiences impact all of these brain centers. Behaviorally, what we begin to see is emotional distress, poor emotion regulation, greater impulsivity, learning difficulties, and physical and mental health problems. More recently, science has begun to look at how ACEs cause changes in gene expression through a process called epigenetics, which helps us understand how nature and nurture interact. Epigenetics causes changes in the way genes work without changing the DNA code itself. This occurs through chemical changes influencing how the code is used. In other words, genes are like the hardware in a computer. They determine the boundaries of what is possible. However, we need an operating system to tell the hardware what to do. Epigenetics is like the operating system directing the function of a gene's DNA hardware. The genes we are born with are the genes that we have for life, but experiences like nutrition, exercise, smoking, stressors, and relationships all affect our biology. Adverse childhood experiences are associated with epigenetic changes related to stress, brain development, cognition, and systems associated with mental and physical health. Changes that happen early in brain development are more likely to be enduring and are possibly passed on to future generations as well. The good news is that positive, supportive relationships at any stage in life can make a difference. However, supporting families and children early on will help prevent many of these negative outcomes. One of the key ingredients for healthy development is having warm, loving, and actively engaged caregivers. This involves promoting serve and return interactions, where caregivers actively and warmly engage with the child, making eye contact, responding to sounds, words, gestures, emotional needs, and sharing experiences like reading and play. Providing programs that support caregivers to strengthen these abilities are the blocks that build healthy foundations for life.
I hope you enjoyed that video. I think it taught us a lot about how trauma affects the child, and particularly in the critical, sensitive developmental years of early childhood. It's important that we're aware of this so that as we continue our conversation about the specific impacts on children, we can also be thinking about how we as caregivers can make a difference. We're going to spend some time right now reviewing some of the material we heard in the video, but also some new information. So as we look at all of the different areas of development and of wellness for a human, we want to take into consideration the impact that trauma has on these different developmental processes. So let's start with cognition. The impact of trauma on cognition is significant. It impairs our readiness to learn new things. It impairs our ability to maintain memories, critical thinking, problem solving. It may even impact our language progression. So you might see with younger children that there's a delay in language development. We see problems with concentration, and again, retention of information, being able to finish what one starts in terms of reading and completing assignments. Poor academic achievement is linked to the impact of childhood trauma, particularly as one progresses through the school system. As we look at physical health, everyone is fairly aware now that the science supports that stress and trauma can have a huge impact on one's physical health. We specifically see research supporting sleep disorders and eating disorders. Sleep for children is very important for their development. And when a child is experiencing trauma, sleep is a time when they may not feel as safe, or because they're trying to quiet their minds, they may feel restless or suffer from sleep terrors or nightmares. Eating disorders are also common with young people and teenagers. One starts to be able to look at addressing their problems through controlling the one few thing that they can control. It affects the immune system. As we know, the impact of brain functioning and the immune system is definitely influenced by the stresses. We're going to be more prone to disease and infections. And as life progresses, we see an increased risk for cardiovascular disease, high blood pressure, obesity, systemic disorders like autoimmune diseases, and cancers. So it's easy to see why the research supports that those with childhood trauma have a shortened lifespan. As we look at emotions, this is a very critical point, particularly for our younger children. They have very big emotions around trauma. They may have difficulty controlling these emotions, temper outbursts, tantrums, uncontrollable crying. They may also have trouble recognizing emotions, may not be able to put into words what they're feeling or what the source is of these feelings. They may get confused between what anger is and what fear is. We also find that they have limited coping skills. When one is focused on safety and one is focused on dealing with very sensitive feelings, they don't always have the ability to look within that toolkit and see what coping skills are already there. They're in a highly emotionally charged state. They have an increased sensitivity to stress. It doesn't take much stress to push someone over the edge when they have childhood trauma because they're already living on the edge. There's a lot of shame and guilt. Our little guys and gals believe that everybody knows what they've been through, and many of the experiences involve a lot of shame and feelings that one was responsible for what happened. Excessive worry and hopelessness are feelings that are very common for individuals who have childhood trauma. Feelings of helplessness, having no control over what's going on in one's life, and a lack of self-efficacy. Now, self-efficacy is that skill we have where we believe we can do things. We believe that we can master certain tasks. We believe that we can overcome things, and we believe that we can succeed. And without self-efficacy, you're left with kind of feelings of hopelessness and being lost. When we shift to relationships, the impact on childhood trauma is felt from the start of birth all through the lifespan. It's very common for our children who have childhood trauma to experience attachment problems, difficulty connecting with other people, being unable to show or accept displays of love or affection easily. They also can experience reactive attachment disorder, which is a DSM diagnosis that has to do with either attaching too easily to individuals, which can put a child at risk, or being unable to attach to caregivers, when clearly they should feel some sort of empathy and connection. There's a poor understanding sometimes of social interactions, an inability to read social norms and social cues, and to respond accordingly. Sometimes this can look like they're experiencing a spectrum disorder of autism. It's sometimes difficult to separate what is a cognitive disorder and what is the impact of childhood trauma. They often have difficulty forming relationships with their peers. They don't connect well with their peers. They don't feel like they belong or connect or are even worthy of friendships. So we might have bullying behavior, or we might be bullied as a child with trauma. We just have an overwhelming fear of connection. Later in life, problems with romantic relationships and the intergenerational cycle of abuse and neglect are common. If one's not able to work through the impact of their childhood trauma, it's highly likely that they will repeat the cycle with their own children. When we look at mental health, we have many things that are impacted by childhood trauma, including a higher risk of depression, a higher risk of anxiety, a very measurable negative self-image and low self-esteem, much like I was talking about a few minutes ago when we talk about self-efficacy. They have very strong feelings that they're not worthy of love, that they're unable to cope with things that life throws at them, and they really don't have a sense of validation of who they are. There's also a DSM diagnosis called post-traumatic stress disorder. I'm sure you've heard of it. And a lot of our individuals who have childhood trauma suffer from some of the symptoms of PTSD. Not all of them, but certainly a large proportion of them. The kind of symptoms where you have avoidance of situations, sleep disturbance, including nightmares, flashbacks, increased anxiety, increased hypervigilance, increased hypersensitivity. We'll learn more about these as we talk about different age groups. There's also a higher risk for suicidality. So this is something we always have to be aware of with children and adults. As we look at behavioral response to trauma, what you're more typically going to see, particularly in younger children, is poor regulation of their behavior. Just like we talked about being unable to regulate emotions, they're often also unable to regulate their behavior in response to their emotions. So we might see some uncontrolled hitting or pushing. We might see some self-hitting. We might see temper tantrums again. It's also common to see a child withdraw socially. Again, not feeling connected, not wanting anybody to know what they've been through. They just don't feel like they belong. Plus, they often lack the social skills they need to feel a part of the group. It's not uncommon that their behavior could become aggressive, particularly if they've witnessed aggressive behavior or if they've been the victim of aggressive behavior. Some of these children have a lot of anger, not only for what they've experienced, but also for the impact on their life in terms of things like being removed from their homes or having to switch caregivers. We see poor impulse control in childhood trauma. You might notice that a child will take risks, run out into traffic, or not listen to directions in order to be safe. Later in life, you'll see this transfers itself into risk-taking and illegal activity, sexual acting out, and sometimes a higher risk of adolescent pregnancy. And of course, there is always a risk that is far beyond those without childhood trauma to take up drugs and alcohol misuse. In fact, a lot of our childhood trauma victims report that they started using drugs and alcohol as young as the age of 12. And our last category is actually in the area of neuroscience. You heard a little bit about this in the video, but we do know that individuals who experience childhood trauma do have a smaller brain size. The theory is that the chronic stress and trauma impacts the ability of the brain to develop in a normal way. This also leaves an individual with less efficient processing of information, impaired stress response. We talked about either not responding to stressors in an appropriate way or over-responding. They're just not able to regulate their stress response to the actual experience. This is what they were referring to in the video as the changes in gene expression. So now that we've looked at some of the impacts of childhood trauma on individuals, let's flip that coin, shall we? Because there are protective factors that can help a child become more resilient and overcome some of these risk factors. So let's start at the top. Parent connectedness, caregiver attachment. I can't stress that enough. As a family therapist, I can tell you that the majority of the cases I see with children that are having difficulty is that there's an attachment trauma there. So the connectedness to a caregiver or a parent figure is critical to child development. They need to feel wanted. They need to feel loved. They need to feel like they belong, and they need to feel safe. Another protective factor is connections to non-parental adults, role models, people who show they care for their child, even though they're not family. This gives the child a wider net of safety and belonging and places that they can go when they really need to ask for help. School safety is another protective factor. When they come into your care at your center, they feel safe. They feel like people are watching out for them. They get affection and attention, and they feel like they're locked away in a safe place of learning and growing and being with other children. The closeness of caring friends is critical to attachment. One needs to feel that they fit in, that they belong. And where else to get those feelings than a nice, supportive daycare or early learning center? Through your activities there, you promote peer connection and play and exploring each other's likes and dislikes and how to negotiate friendship. These are important developmental tools. Overall resilience plays a factor as well. How hardy is a child? Are they able to see the world through optimistic eyes? Do they feel hopeful? Do they reach out every day with a sense of positivity? Maybe sometimes they struggle with that. And that's where these adult caregivers and you at the daycare centers can really promote those activities that tell a child that they can overcome. Neighborhood safety is a protective factor. Now, I know a lot of our children can't pick their neighborhoods, and maybe those neighborhoods aren't as safe as we would like to raise children in, but sometimes we don't have a choice. But knowing that one can go to one's neighbors, knowing that one can go outside and not feel afraid is a protective factor. We also, as caregivers, no matter what level we're taking care of children and families, have an obligation to make people aware of and provide access to health services. We need to keep our children healthy. We need to keep their families healthy. And it's important that they know where they can turn when disease or malfunction or any other impact to physical health becomes an issue. And the last one is academic achievement, or in the case of a lot of our younger kids, developmental achievement. So it's up to us as the adult caregivers taking care of them to provide that positive reinforcement when they've learned a new skill or learned a new concept, to really show them that their self-efficacy is well supported within our care. So let's look at why trauma-informed care is so important. If we look at the cycle of trauma, we start with an event. Now, trauma is defined by the person who lives it, so it's very subjective, and it should be. So a trauma occurs in a child's life, and they may experience emotional, psychological, behavioral damage. This damage, because a lot of our younger children do not have communication skills or language to tell us how they're being impacted, can lead to behavioral problems. Now, in the normal course of trying to manage a daycare facility or a public school, the normal response to some behavioral problems is punishment. But for a child who's experienced trauma, to first go to punishment as a reaction or consequence to behavior, unfortunately, re-traumatizes them. So now we're going to go over some common signs of trauma in our little people. Separation anxiety or clinginess towards the teacher or their primary caregiver. So they may not want to let go of their caregiver when they come to your services, but they also may not want to let go of you when it's time to go home. A regression to a previously mastered stage of development is a sign of trauma. Maybe they were potty trained and now they're having more accidents, or maybe they were walking and now they're choosing to crawl again. Lack of developmental progress. There are milestones that they're just not meeting or attempting to meet. A recreation of the traumatic event. They may act it out with you as the caregiver, or they may act it out with other peers. That's their way of trying to process what they've been through. They may have difficulty at nap time or bedtime because calming down when you're in a constant state of distress can be an arduous experience. So they may fight nap time or bedtime. They may have difficulty calming down or difficulty sleeping. Maybe bedtime was a time when they don't feel safe at home, when bad things happen. They may also present with what we call somatic complaints. Now, these are complaints of a psychological nature that are manifested in physical complaints. Tummy aches, headaches, those are the most common with our little people. Constipation, diarrhea. These are also complaints that we see very commonly with our younger population who, again, don't have the words or the language to explain what's going on. We may see drastic changes in behavior or just an abrupt change in behavior. Things that a child used to do or find pleasure in, they're just not doing it anymore. Their personalities are changed. They're not as happy. They're not as carefree. We may also notice them over or underreacting to sensory input, like physical contact, bright lights, sudden movements, loud sounds. We may find that they have a startle response that's stronger than they used to have. There'll be an increased distress, more than likely, because again, big feelings, scary experiences, they just don't have the coping skills to deal with these. So distress is their way of communicating. Anxiety, fear, and worry about the safety of themselves. Am I safe? Is anybody going to hurt me? Monsters become a real threat at this time, but also the safety of others. You may find them preoccupied with, is mom okay at home? Or are you going to be okay when you go home from work? They may also worry that the traumatic event will repeat itself, and that makes sense. And so they may be preoccupied with what's going to happen when I get home. They may have new fears they didn't have before. Maybe now they're afraid of high places, or they're afraid of the swings. or they're afraid of bugs. It doesn't really matter what they're showing that they're fearful of. It's the introduction of new fears that's a sign of trauma. And then lastly, they might have questions for you or make statements about death and dying. Maybe they had a loved one who passed away and nobody's really communicating with them because they think they're not old enough to handle it. The other thing is they might have witnessed an overdose or some other traumatic event at their home, which makes them worry about the dying process. What does it all mean? We have to be careful as we answer these questions because children can only handle what they're developmentally able to handle. There are really great books for preschoolers like The Fall of Freddie the Leaf that can help explain the cycle of life and death and dying. But for the most part, this is an area that the primary caregiver should be addressing with the child. All right, so now we're going to look at specific populations. Let's start with babies and toddlers. So some of these things we've talked about already, but they apply specifically to our babies and toddlers. Unusually high levels of distress when parents drop them off. As we talked about before, a little separation anxiety. They may experience what we call frozen watchfulness, appearing to be in shock or not taking in their surroundings. This, again, is a reaction to trauma. They may appear to be numb or cut off from their surroundings. Maybe they're not responding to sounds or movements or interactions around them. Maybe what should hurt, like getting one's fingers caught in a cabinet, doesn't seem to affect them. You may also notice, as we've talked about before, regression in physical skills such as sitting, walking, crawling. Maybe a loss of playfulness. Maybe they don't smile as much as they used to. Maybe they're not capable of cooing anymore. They just don't want to interact in the playful activities that they did once. It's common to see a loss of appetite, avoiding eye contact. It's very important with our babies and toddlers to establish eye contact. And as they avoid eye contact, that's a sign of fear and anxiety. They may be difficult to soothe when they're upset. Again, remember, they're in high crisis activation. They don't understand what they're going through, but they know it doesn't feel good. And so it's up to us to give them that time and space, as we're going to talk about here in a minute. You also may notice increased clumsiness. Because they're in heightened crisis mode, they may not be paying attention to how they're walking, how they're grabbing, how they're standing up. They're focused on higher emotional states. So, for our babies and toddlers, what is a trauma-informed response? That's what this training is all about. We want to provide structure and predictable schedules. Consistency is what helps a baby and toddler feel safe. So keeping those schedules, providing those activities on a regular, predictable schedule, feeding on a schedule, napping on a schedule, it's very important to keep these things in place. As I said before, lots of eye contact and pleasant voices, soft, soothing voices. Also a nurturing physical touch. Both of these things, eye contact, pleasant voice, physical touch, these are the things that increase the hormone called oxytocin, which, if you're not aware, is an attachment hormone, and it makes us feel loved and attached. And when oxytocin rises in a baby or toddler, the stress hormones are automatically suppressed. So these are the things that I think we all know babies and toddlers need. Giving them one-on-one time when they feel distressed, particularly with all of the interventions that are going on around them with other kids, and quiet activities and soothing sounds. We've got a highly activated young person here, and they really need to have a space of calm. All right, let's shift over to our preschoolers. We might see new or increased cleaning behavior, much like we saw with our infants and toddlers. They don't feel safe. They feel threatened. They might develop new problems with basic skills like sleeping, eating, and toileting. It's not uncommon, again, that a preschooler might regress to being a bedwetter or wetting during the day, or even having trouble with their bowel movements. You might see a loss of enjoyment from the usual activities. Maybe they used to like to play on the swing set, but they don't want to do that anymore. Maybe they just want to sit in the corner and look at a book. You might notice increased fear and startle responses. We've talked about this before. These are signs of PTSD. They're at high heightened crisis response. We've got to remember this. They may have physical complaints, as we talked about with our infants and toddlers, stomach aches, headaches, their eyes, their elbows. There's no limitation to how the body will express chronic stress. You may also notice inability to keep attention and focus. We may notice mood changes. Maybe they're happy one minute and very, very sad the next. Maybe they're angry. All of these moods are reflections of the internal experience of this child. They may be tired. Maybe they're not getting enough sleep at night at home. Maybe they're spending too much time thinking. And remember, this kind of chronic stress takes a toll on the physical body. It's also very common that they might get aggressive because they have big feelings and they feel out of control and they feel like there's nothing they can do to stop what's going on in their family or their home or their lives. And so one way to communicate is to show aggression. But remember, this aggressive behavior is a form of communication. It's not generally meant to hurt anyone. It's just a way to let us know that something's going on. So how do we respond to our toddlers? Our preschoolers. We reassure the child that they're in a safe place. Your learning centers can be one of the safest places they experience during their day. Help them name their feelings by having conversations with them as they play, as they do their work, as they do their activities. How are you feeling right now? How does that feel when that happens to you? If we can name the feelings, we can talk about how to control the feelings. Do not ask what happened to them. We are not here to investigate anything. We're not here to gather information. And as we talk about Handle with Care, that is why Handle with Care works, because we do not ask what happened to them. We just are with them and try to help them deal with their feelings. We validate them and we make them feel safe. Again, increased eye contact, soft voices, and separate them if they get overwhelmed with being with other children, but don't leave them alone because that can raise their anxiety level and cause them to feel unsafe. So as we've talked about these different ways to use a trauma-informed care approach, you can see the value of looking at a child and saying, what is wrong with her or him today? And ask yourself, what might have happened to this child that's making them act differently? Trauma-informed care in child care centers and in schools can prevent re-injury or re-traumatization for these kids. They feel safe, they feel seen, they feel calm. It can reduce the stigma and reduce the punishment for children. Remember, when a child is in a traumatic state, punishment reinforces their trauma. So we've got to look at other alternatives so that a child feels like they're not being punished for what they've been through. It can also decrease behavioral incidents because children will choose words, they'll learn other ways to deal with their feelings without having to act out. So if you do a trauma-informed care approach in your early learning setting, you need to be able to be sensitive to trauma. You need to provide a safe, stable, and understanding environment that validates a child, and you need to invest in training staff on a regular basis of the principles of trauma-informed care. So now we're ready for Handle with Care. I can't tell you how excited I am to introduce early learning centers to Handle with Care. Handle with Care has been in Manatee County since 2018. And what I can tell you is that the data shows us that our law enforcement officers and first responders find a lot of kids, pre-K and younger, at the scenes of potentially traumatic events. And we responded to those numbers and said, we're missing a lot of kids who could really use Handle with Care. So that's why we're asking you to get trained and participate with Handle with Care. You're going to be totally blown away about how this changes how we react to children. We're going to take a few minutes now so that you can learn more about Handle with Care and get as excited as I am about introducing it to your center.
It's shocking but true. 60% of American children are exposed to potentially traumatic events like violence, drug use, or crime. These experiences can have devastating, long-lasting effects on kids.
Trauma can have a negative impact on a child as well as the child's family.
It impedes their ability to learn and to be successful in the classroom.
Inability to focus. They may be tired, considering if the situation might have happened at 3 o'clock in the morning. So it's difficult for them to build trust, and they're constantly on a high alert. They're afraid that something may happen to them.
A vast majority of our calls have children at them, a lot of them.
They could be domestic violence. They could be a parent that overdosed that the child witnessed, a shooting in the neighborhood that's now frightened the child. There are just a number of different types of calls that a child can be exposed to trauma.
Trauma can have long-term effects on children, making them at risk for future problems like skipping school, failing to graduate, and getting into trouble themselves. Too often, the cycle of trauma repeats because it goes unrecognized and no one intervenes. That's where Handle with Care comes in. Handle with Care empowers the community to unite with the goal of protecting traumatized kids so they can heal and thrive.
Handle with Care is a simple but effective collaborative model to reduce the effects of trauma on children. We open the lines of communication between the first responders who are there when the trauma occurs and also those who are responsible for the learning of the students in the schools.
Here's an example of how it works. Police or other first responders are dispatched to a potentially traumatizing situation in the community. If a child is present, police identify the child and generate a Handle with Care notice.
The deputy just has to fill out a very simple form with the child's name, their date of birth, and the school they attend, and then just basically hit send on their computer.
And a message is sent to the school or care provider that simply says, Janie Smith, Handle with Care. That's it. To protect the family's privacy, no other details about the student or the incident are sent.
When our staff receives the notice, they just make sure they have a heads up, first of all, and they're aware. And then they observe, and they make sure that the student isn't struggling or having any issues.
And that child would show up to school the next day and could be tired, could be combative, whatever the case may be.
If they notice that there are any issues going on, that's when they might intervene and say, hey, would you like to go to the nurse's office, lay down for a little bit, or maybe we could just postpone that project for a while.
The student can then be connected to mental health care and other services.
So what we're trying to do is recognize that discipline is not always the best response to behavior in a child, because behavior in a child could be a form of communication of the need for help.
If we can recognize that that child is just going through that traumatic event and give that child some quiet time and redirect, it's going to change the dynamics between the school and that child, and the child may be more successful in the future.
The Handle with Care model helps create better outcomes for children exposed to trauma.
At its most basic, Handle with Care is about changing the paradigm in communities to really focus on children as the future of the health and wellness of any community.
One of our goals was to catch children who may be falling through the cracks, children that we wouldn't have had our eyes on previously. And what we found, especially at the beginning, was that we're doing just that. And we're able to respond to those children and potentially their families and offer them the services that they need.
We are able to help them process the traumatic experience that they've gone to so that they can continue to be productive, not only in the school system, but in the community upon adulthood.
There's not that much work to it, and it's working. I mean, it's obviously helping the children.
And each of us needs to understand what may be happening out there in order for us to step up and be able to help them.
The children of our community are the future, and we need to protect them.
It's going to be impactful, and it's going to be far-reaching when we all work together to do that.
Handle with Care helps build a better future for vulnerable children and ultimately the entire community.
Handle with Care works. It has the power to transform individual lives, families, and communities as a whole.
I really encourage any community that says they care about children to really look at the Handle with Care initiative and implement this initiative in their community.
Start building that future in your community. Contact Handle with Care Florida to get started.
I hope you enjoyed that. That gives you a little brief overview of Handle with Care. So now let's go through the process of how notices from law enforcement and first responders get from the scene of a potentially traumatic event to you, the child care provider. As we look at this drawing, we see that the first responder who responds to the scene of potentially traumatic event, as it said in the video, looks around for any children, infants, toddlers, preschoolers who might be witnessing or a part of an event. They then take down their name, their age, date of birth, and what child care facility they are taken care of by or where they go to preschool. The first responder then goes to their laptop or their email or their phone and sends an email to the Early Learning Coalition. Your Early Learning Coalition then identifies the child care provider that is attached to this particular child, if they are within their system, and sends an email to that particular child care provider, hopefully before the start of the next day. The child care provider then alerts the staff that Johnny Smith needs to be handled with care. We're to observe and respond in this trauma-sensitive way that we've trained you on today. If the behavior or other incidents throughout the day indicate that more assistance is needed, follow the usual protocols of your center. It is important that we help you also inform your families that you're going to be a Handle with Care provider. Manatee County has been a Handle with Care county for 4 years now, and we hope that we will go on for many more. But this is going to be new for some of your families who have children in your early learning centers. Remember that no details about the incident that any child was a part of will ever be shared with you at the daycare or child care center. All you will know is that something is going to impact this child or could potentially impact this child at school or the center the next day. We will provide you with posters and cards to leave behind and brochures, whatever you think your center needs to make sure that your parents are aware that you are a Handle with Care provider. And what a distinction this is in the community to show that you really care about the safety and well-being of the children that you serve, and you're willing to step up and be part of the solution. Remember, listen very carefully to this statement. A Handle with Care notice from law enforcement or Child Protective Services does not take the place of a mandated reporter call. Do not assume that because a Handle with Care notice was completed at the scene of a potentially traumatic event, that there was a mandated report or call. Many of these events do not involve a mandated report or call because a child was just present and not necessarily part of the incident. So you still follow all of the other protocols that you've been taught about observing and taking notice of how a child is acting as part of your mandated reporter protocol. Here are some resources that were used to create this training for you. I'm going to leave this screen up for a few seconds so that if you want to get out your cell phones and take a screenshot of some of the additional research that you can look up, you can do that. It's also important that you get out your cell phones right now, because on the next page, we're going to have a QR code that will take you to the link for your quiz. And after you take your quiz, you will be able to click on a link that will take you to print out your certificate. I hope you enjoyed this training, and I hope you want to know more about trauma in children as you go through your professional development and as a parent, perhaps. So as you look at this particular screen, please get out your cell phones and scan the QR code for your quiz and directions to download or print your certificate.